Okay, we are going to go ahead and get started. Welcome, everybody. We're going to go ahead and get started so we can stay on schedule today. My name is Justin Van Houten. I am a advisor and an owner here. And I just want to introduce our team really quick, and then we will jump into today's topic, right? Because Medicare is always a huge issue for a lot of us, and there's always a lot of changes. We have a great resource here that's going to help us today. So, starting out, just introduce our team real quick. We have all of our wonderful admins here: Julie Greer, Cheryl Hurst, Hannah Mason, Nancy Economist, and Joanna Waniger, right there, Joe Waniger. And we have our advisors too: Alan Holstein, Steve Connard, Michelle Bjorkren, Caleb Pearson. An important alum is in the building as well, Kurt Pearson. And then Guy Lehman, who usually does this, is not here today. He had something going on, but he may be watching probably. So we'll go ahead and get started here. I want to introduce Lynn Schrader from KHI Solutions. She's the president and an owner there. And Lynn, the floor is yours.
Test, test. Let me make sure that's working. Okay, so good afternoon. I know we've got our group that's right here live, and then we've got our group that's online streaming. So good to see everybody. And I love Medicare. I don't know how many people can say that, but I get so excited about helping people understand Medicare. So I hope our goal of today is to make sure that you have a better understanding of what it is. For those of you that are already in it, for those of you that are soon to get in it, this is for all of you. So before we begin, if I could ask you to make sure you mute your cell phones. I did hear one ringing the other moment here just a little bit. So if you could go ahead and get those turned to vibrate or silent, that would be wonderful. And you know, you always make that announcement, and then it never fails during the presentation, right? Something goes off. And then don't we all do the stare? Whose phone is that? All right. No, that would be super helpful. And if you have, hopefully, yeah, you have some notepads or note paper and pen on the table. So please, if you feel so inclined to jot some notes down, that would be great. I want to tell you just a little bit about KHI. So as Justin said, I'm one of the owners, co-owner. It's owned by myself and Brenda Eckert. I'll get to that slide next, but we have 4 locations around Iowa. So we've definitely expanded. Our home office is Fort Dodge. That's where the majority of our staff are located. We have about, I think we're up to 39 employees. When we bought the company about 15, 16 years ago, we were about 12 employees. So we're seeing a need to get out there and take care of clients, and they see the value in us, so we keep growing. So God is good, and I'll tell you that. So we're Fort Dodge, and then our Johnston office, that's where I'm out of. My business partner Brenda's out of the Fort Dodge office. We have a small office in Manson, and also we got one up in the Lakes area, up in Arnold's Park near Okoboji. So you can find us, KHI Solutions. All right, so there's my business partner Brenda and myself, and yeah, it's awesome. We are a privately held, woman-owned right here in Iowa. Woo! So, and it's funny now, you see all these faces, and I had somebody go, I'm sorry, excuse me, do you have any men that work for you? And we do have a couple men. They're kind of in behind-the-scenes roles. These would be all the gals that actually would take care of our Medicare clients. So we do have a couple guys, but again, one of them's in contracting and the other one is in data entry. So, but yeah, yes, so we do have a couple men, but mostly women, which is just the way it goes. Our presentation today, we're going to cover these items. We feel, I've been doing this a long time, and these tend to be the ones you have questions on. Now, if you really have a question you're just got to ask, you can certainly jump in. That's fine. But I'm telling you, I probably will answer your question, and then we will open it up for questions at the end. So if you do, use that note paper so you don't forget and jot down your questions if you could. If you ask a question and I know I'm going to cover it, I'll ask you to hold that until the end, okay? So we're going to talk about eligibility. Who and when do you get into Medicare? What are the parts of Medicare when it was built in 1965? How do we get enrolled? And then, of course, if I want to delay my Medicare, can I do that? Absolutely, you can do that. And then actually, what kind of coverage does Medicare offer, right? What do they have? And then how do we fill the gaps? Because we know Medicare doesn't cover everything. When they built that program for us, it left some gaps, and we'll talk about that. And then we'll open it up for questions. So hopefully that sounds good to everybody. See you. And we'll keep moving here. All right, so who's eligible for Medicare? So yes, it's true that you need to be a permanent resident for at least 5 years or a U.S. citizen. And I just had somebody say, we just had somebody come over from another country and they haven't been here 5 years. They're not going to be eligible for the program. So there are some rules, but it is pretty flexible. You can come over as long as you're here, even if you're not a citizen. You have to be a resident, right, for at least 5 years. Age 65 or older. So this is not to be confused with Social Security, because that is like, when do I draw my Social Security income? That won't happen until you decide at 62, 63, 64, right on up, whatever your full retirement age is. And that's where you get to talk to the great folks at Compass to help you figure that out. But Medicare is still 65 years old. You can't get it any sooner than that unless you're on disability. I did have a relative that was on disability. She got diagnosed right away with Lou Gehrig's disease, ALS, Lou Gehrig's disease, and that will get you immediate Medicare Part A and Part B, because they know that once you are diagnosed with ALS or Lou Gehrig's disease, you probably won't be able to work anymore, and so you're going to right away get access to Medicare Part A and B. Other people that say I fell off a ladder and I broke my back and I can't work and now I've filed for disability and they've given me disability, I generally then have to be on disability 24 months where I still can't work. Then I would get my Medicare A and B. So just so you know, there's just a couple differences on, you can get it when you're not quite 65, but they're all disability related, okay? So most of us in here are probably going to age in, right, when we turn 65. All right, so the parts of Medicare, and by the way, you guys, this is referred to as original Medicare. Why? Because they're changing some of the parts of Medicare since its inception. And as I mentioned, 1965 was the year that Medicare came to be. And the first recipient, I love this little trivia fact. So excuse me if you've heard this before, but Harry Truman was the first enrollee on Medicare in 1965. He was born in 1901. He turned 65 in 1965. And so he was one of the first enrollees. And when they built Medicare, they said, let's make it two parts. Part A, let's call that the claims for hospitalization benefits. Let's do that when you have to go into skilled care or hospice. We'll route those claims through Part A. And then we're going to build Part B. What's Part B then? Well, we'll get to that in a second. I want to make one more comment on Part A. And you'll notice here that you've paid into this. We call it free. Medicare Part A is free, but you've paid into it all the years you've worked. And you qualify this as free. I'd say it can be free as long as you've worked at least 40 quarters, 10 years. And you've contributed into the Medicare system. And you can notice that on your payroll. When you get your pay stub from work, it'll say there's a deduction there in your payroll taxes for Medicare. And that's us paying the Medicare tax to cover Medicare Part A for zero premium. So again, should be free. But look at that number, you guys. If you don't end up contributing that long, or you're new into our country, you'd be paying over $500 a month for Part A every month. So that's a great value. And again, the benefits you get are more around hospitalization and skilled care. How many's ever had to be in skilled care? You know what that is? You've had family members. I know my dad had knee surgery, and he had to go into skilled care to get rehab. They were done with him in the hospital and pushed him out into skilled care. And then he rehabbed there because mom couldn't move him and lift him and all this stuff. He had double knee replacements, so that makes it even more difficult. And then they move him home. So it's that short little stint usually you're in to get rehabbed before you can get home. So that's skilled care, and there's rules around that. So that's part A, okay? Okay, so let's go on to Part B. So Part B as in boy then is the services like going to the doctor, having just a primary care visit. It could be outpatient surgery. We call it DME, or durable medical equipment. I need a walker, or I need a cane. Those kinds of things all flow through Part B. And there is a premium for Part B. And you'll notice here on the screen, it's $174.70 this year. Now, the government ratchets that up or down every year. It did go down, you guys, right after COVID. So it was really interesting. When COVID happened, they ratcheted it up, I think, for fear. And then they ended up bringing it back down because we didn't maybe incur the claims. Well, guess what? We now are incurring a lot of the COVID claims. And so they put it back up again. So we'll see that. I'm hearing, I don't have the numbers yet for 2025, but I'm hearing there will be an increase. So kind of stay tuned. If you're already on Medicare, that's currently being drawn out of your Social Security check right now. So you don't have to pay it. It automatically, they take that money, okay? So you don't even see it. So, but they usually send you, Social Security will send you a statement, and so you can see how much is your increase. Woohoo! I get that big, 2% increase or whatever, and then they've also increased your Part B premiums. So you're like, I hope I can net something out of here, right? So more on that soon. I also want to talk about IRMA just for a moment, and this is about managing your income, and this is where Compass comes in, so important. Managing your income once you're on Medicare to keep it below a certain threshold if you don't want to pay more for your Part B premium, because this is the base, $174.70. But I dealt with, and I don't mind telling the story, and rest his soul, he's not with us any longer, but Barry Griswold, who ran Principal Financial Group back in the day, I got a chance to meet with Barry, had questions about Medicare. And when I told him about IRMA, yep, he was paying, and I will tell you, the highest rate would be about $564 a month. That's what he was paying instead of $174.70. Why? Because of his income. So when the government looks at your income and go, hey, and off the top of my head, this year, I believe, without double checking, 203,000 as a joint couple, or 206 and 103. I believe those are the numbers. They're always double. So if you file single, it's 103. If you file jointly, it's 206. Those are the numbers you need to keep. Well, I think Barry was making more than 206. What do you think? I think he was, yeah. So anyway, so IRMA is a good thing to keep an eye on. It's called the Income-Related Monthly Adjustment Amount. That's what IRMA stands for. And I always say, we don't like IRMA. Nobody likes IRMA. Poor thing. I hope nobody's named IRMA in the room. No offense. All right. So the other caveat on Part B, if you don't sign up when you're supposed to, there could be a penalty, okay? And so we're going to talk about that a little bit more when we get into, do you want to delay, and what if I'm still working? We might have some folks in there. Some of you are already on it and you're like, that's not of interest to me, Lynn, but I do want to cover that because some people are still going to work past the age of 65, because that's the trigger, you guys. 65 is the trigger of when you're eligible for it if you're not due to other conditions, right? Like I said, disability, all right? So we'll talk a little bit about that, but a penalty can apply if you don't take it when you're supposed to. But that's why, you guys, I have to tell you, I was just mentioning this earlier, use an agent. You guys, our commissions are built into the product. You don't pay any more or any less if you use us. So I always tell people, use an agent. I mean, find somebody you trust. I know we've got resources here. Compass will direct you. They have your best interest at heart. That's what I believe. We are one of your trusted partners, or I wouldn't be here today, right? And we've got staff that are willing to help, but I just encourage you to use somebody. I just talked to a lady on the phone and she's like, no, I'm not using an agent. And I go, okay, and that's fine. She was talking to me and I go, but you can use me. I'm not getting paid, but you're paying it, whether you use me or not. And we can help you guys navigate this, okay? So there might be some one-on-one, or like I'll say personalized questions you might have even today. Some of them is great to answer for everybody, but some it gets so unique into your unique situation because many of you have spouses, and what are their ages and when are they aging in, et cetera, right? So we can get into kind of, and where are you getting your current insurance benefits and that type of thing. So, okay. I just want to see if there's anything else there. I think that's it. Okay, and we'll talk, like I said, a little bit more. There it is. Okay, I thought I was right, 103 and 206. I have it on the slide here. So you can kind of see if I will tell you this. Now, as an owner of a business, the day I decide to sell my company, I hope, my fingers crossed, I hope I get a nice little check. Like, here you go. Thanks for all your hard work. Well, that might kick me a little over to 103 or 206 filing jointly, right? And so what we can do is there is a separate form for those that have these, or let's say you got an inheritance, right? Mom or dad died and you just got this or that, like either an investment fund or you got farmland and you're selling it, whatever the case is. There's a special form you can complete to ask the government to not calculate that in this for a whole year, because it goes a whole year. And they look at your taxes. They look at your modified adjusted gross income. And it's interesting if they look 2 years back. So right now, in 2024, they're looking at 2022's tax return to determine if you owe anything for IRMA. And so just keep that in mind as you're looking at your income over time and when you might want to phase out of your work, or if you're going to get this lump sum, you may. And we help our clients. We can't work with them. We give you the form. I have a form that you can fill out and get it in. We can help you get it into the government, but it's then you kind of working with the government and letting them know, hey, no, this was a one-time deal, and I'm usually under the 206 or 103. Okay? All right. Good on that. So then how do I enroll? So that's the great next question, right? And the government makes it, I think, somewhat easy, but we are here to help you. You can do it on your own. If you're one of those that, I got this, I can do it, I'm tech savvy, I love getting on the computer. How many of you have set up your own SSA.gov account? You're set. This is good if you have your account. Why? Because as you know, we're not getting those statements as regularly as we used to, right? That say, hey, here's how much we show your income is. Here's how much if you're drawing Social Security. And some of you guys are getting your statements that show you're already on it, and here's the deductions we're taking. But I love it. I've set mine up as well. We have to have that account in order to sign you up for Medicare. So there you go. And now this is where Social Security and Medicare are together for a little bit. You use the socialsecurity.gov site to sign up for Medicare, and then your Medicare Part B premium can be deducted out of your Social Security check. But then that's about it, you guys. I mean, what you do and when you take Social Security doesn't have anything to do with when you take your Medicare. I'm just telling you, those are really two separate decisions on when you do either, okay? However, this is where it gets confusing because they're accessible on the same website, okay? And then once you're signed up for Medicare, then you actually have your own Medicare account. So once you get a Medicare number, then you'll have a Medicare account. We help you with all, this is what we do, guys. We help you decide when to do it. We help you sign up for Medicare. Once you get your card, we have you come in, and then we talk to you about your options to fill the gaps of Medicare, okay? So this is giving you a little bit of timing here, but usually if you're already drawing Social Security, let's say you were one that said, I took my Social Security at 62, baby. I'm getting it as soon as I was eligible. And I want, that's my money and I want it, right? And so when you approach your 65th birthday, you're going to automatically get your Medicare card in the mail because they're going to assume you're not working and they're going to assume you want your Medicare, okay? So for those of you, most people are like, yeah, that would be true. I'm drawing Social Security. But actually, I had some that said, hey, I got Social Security because maybe my spouse passed away and now I'm getting some Social Security income, but I want to keep working. If you get your card in the mail, then we just help you call Medicare and go, I want to waive it right now. I don't want it yet. So that's an option. Most people, I'd say, that are on Social Security are ready to take get their Medicare. Why? Because a lot of times the premiums are cheaper and the insurance is better when you get to Medicare. Many times. Depends on your situation. So anyway, so normally you'll get your card, but if you're not drawing those benefits, that's where we help you. And there's the website down there. Feel free to get on there and take a look at it. Again, you can apply. They won't let you apply until 90 days out from your, so let's say, okay, my birthday is January 16th. And so I couldn't get on. I mean, January 1 will be my effective date of my Medicare. So it's always the first of the month of your birth. So whatever your day of your birth is of that month, I could get my Medicare effective January 1, and I would go 90 days prior to that. That's when I could sign up for Medicare. So just go 90 days from, so would that be October 1st, right? October, November, December, January? Okay. So just know that it's usually a 90-day window in order to sign up for Medicare A and B. Now, some people sign up for A and not for B. That's usually because you're working. And I'm going to get to that, I think, on the next slide. And I'm going to kind of reiterate what I said here. And this is kind of your eligibility month I was just mentioning. Your initial enrollment period is when you turn 65. And so, as I said, it's the first of the month. So of the month of your birth, you can actually sign up. There's your 90 days before. And actually, they give you 90 days after. So I could not sign up yet. I guess I could just wait. I still get that period of time, my initial enrollment period. And what's so important about the initial enrollment period, you guys, is there's no health questions. So that's the key about your initial enrollment period. They don't care if you've had cancer, had a stroke, you've got some disease, they don't ask any help. It's guaranteed issue during your initial enrollment period, okay? You'll also get a special enrollment period we'll talk about in just a little bit if you're still working. And you stop working, then you want your Medicare, then you get a special enrollment period, no health questions. But this is getting into the products that supplement. That's where it gets important. I mean, A and B, you guys, there's no health questions. You get A and B, but I'm talking about the products that supplement, and they follow the same enrollment period here to get those products, okay? All right. So Medicare and Social Security, and it's funny, they were like, avoid. I'm like, wait, what? Okay, let's go to the next slide, because this is what if I keep working? So I'm going to keep working. I don't want to draw my Social Security yet. I don't want to, I maybe don't even want my Medicare yet. So if you'll notice here that it says, and I hope you guys can see the slide still from over here, that if you or your spouse is actively working, you can delay your original Medicare. Now, we're assuming, and this is kind of a big step, but if you're actively working, you've got health insurance coverage from your employer. I mean, that normally makes sense, right? So it's creditable coverage that you will have with your employer. You're actively working. A big deal happening right now is, and the employers have to provide this to you, is the current coverage that you have considered creditable or not? What does that mean? Is the drug coverage as good or better than what the government has for all of us on Medicare? Okay. Is your employer offering you good enough coverage? And the employer has to give you a letter. Has anybody gotten one of those letters? It's called a letter of creditable coverage. And it's like, yep, okay, my plan is creditable or it's not. The caution is if it's not creditable, then we need to, and you're 65 and you're going to keep working and waiving, all your Medicare. That's great. This is why I say do not take A. Do not take A, because the minute you get into Medicare, even though A is free, they're going to require you have a creditable drug plan. So it's kind of crazy, but again, not to get too far down in the rabbit hole, but all this stuff is that's why we meet individually with everybody to help figure out what is your unique situation and how can we make sure we keep you compliant, no penalties, and everything rock and rolls. But don't be surprised, somebody might ask you, hey, do you have currently do you have creditable coverage? So you'll notice here that if you have a retiree plan or VA coverage even, or you're on COBRA, or you have an individual plan, that does not count as creditable coverage. So there's, again, let us rely on us. There's rules we'll help you figure out to make sure we keep you compliant if you're going to continue working. And again, we always have to worry about your spouse. Then what's happening with the other one if you have a spouse in the picture? Okay. And I had one gal I worked with. She worked at Iowa State, and she said, "Hey, I'm turning 65, but I don't want to retire yet. But they're making me, because I turned 65, get my Part A." I go, "What? They're making you get your Part A? That's the part of the rule." Now, why would they do that? Well, one reason is when you have a large company, not our small businesses, not small companies with fewer than 20 employees, but large companies, which obviously Iowa State is, they can require you to take your Part A because it is free, but they do that because Medicare will pay secondary. So Part A will jump in on the group plan once it's done paying. So let's say you're in the hospital and your group plan pays, and then Medicare can come in and pay the balance, okay, on Part A benefits, hospitalization and skilled nursing. So I don't really understand that strategy and why Iowa State. What's that? When it's a large group, the large groups that's the government. If it's small group, under 20 employees, Medicare's prime. For anybody that's 65, Medicare would be considered primary. On large groups, Medicare is secondary. And I think the government does that on purpose because they don't want to be the one that pays primary. If you're going to stay working on a group plan, the group plan pays first, and then Medicare pays secondary to that on large group plans. Yep. So, okay, again, great. I mean, unique situations, and that's why it's so important. Some people don't even realize. I go, well, generally, if the company you're working for has 20 or more employees, 20 or more is kind of a federal guideline because 20 or more means you get COBRA. It means you are. There's other rules that are tied to 20 or more, and Medicare paying prime or not is one of them, and then COBRA is another one. If you're working for a small business, it's called Iowa continuation of coverage. It's not COBRA. So rules around that, around the size of your employer. Okay.
Back to that creditable coverage.
Uh-huh.
So your example of the individual who worked at Iowa State, did she go ahead and Plan A, I mean, I say she had to, but there might be a benefit for her, provided that she has credible coverage on the backside, right?
Could be.
You get creditable coverage.
And it depends on the plan that Iowa State has. I'm pretty sure they're probably a self-funded plan. I think they're part of the state of Iowa on a self-funded plan, and so they can design their own plan. So yeah, I don't know the intricacies of that plan, but if my friend who did get her A, because they required her to, as long as she was going to keep working and she turned 65, they required her to get her A. She waived her B. She doesn't need her B yet because her plan is standing in for that. She had creditable coverage, so that was fine because the drug plan that they offered was as good or better than what the government has. So she was fine. The only other caveat is if you take your A, you can, and I was just telling Kurt this, if you take your A, you can no longer make contributions in an HSA. Do you know what an HSA is? We probably know a health savings account. So there's rules around that, and they don't allow you. Now, I will tell you, now this is kind of interesting that we just had our election not long ago, and I heard in the prior Trump administration did talk about expanding HSAs to allow people that maybe did take A to go ahead and contribute. So we'll see if any new rules come out on that. I'll sure this is where we stay in touch, and I let you guys know this, because if we have new rules, that can impact also whether you have to take you want to take your A or required to take your A. I don't like taking A because I have a high deductible health plan and I'm putting money in an HSA myself, right? So I will not take A, and nobody can make me. Yeah. The creditable coverage because or HSA. Yep. Yep. HSA or her plan did not offer creditable coverage. Yes. Yeah. Yeah. So HSA or drug coverage. Those are really, to me, the two from your perspective. Why? Yeah. From a client's perspective. Yep. 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 Good. Okay. So here's the special enrollment period I want to tell you about. I told you about the initial enrollment period. Let's say we waived it then. I'm still working, and now I'm 68 years old, and now I want to get my Medicare. So as long as I go back to my employer, we help you with these forms, by the way. There's a special form you have to take to your employer, and they sign off and says, yes, you've been an active employee here up until this date with credible coverage. Okay, so they sign that form. You get that to us. We have the other form that says, I'm signing up for my Medicare. We send that into Social Security. Again, you can do this all on your own, but I'm telling you, use us. That's what we're here for. But we send that in, but you'll notice, so as long as you're covered by your employer health plan. Now, how long do you have? You have a little bit longer. I had another client, and this is just amazing. She was the spouse on her husband's plan. They were on an employer group plan. She was on Medicare due to disability, and she waived her B. She kept her A and waived her B because she was on her husband's plan. He got laid off. She didn't call and tell me that she got laid off. She has 8 months to get her Part B back. And she didn't tell me until, literally, you guys, it was like the 8.5 month. Seriously, it was like we missed it so close. And I go, oh my goodness, you can't get number one, you'll pay a penalty because you didn't get your B when you're supposed to. And now she's gone without B, and she was on disability, you guys. She had stuff going on, medical stuff, right? And I will tell you, and this is, I think, the value of an agent. It went from me to, and then I took it to, literally, you guys, I talked to all the supervisors at Medicare, which they're in these regional offices. Kansas City is a regional office. So now I get involved with the Social Security. Now I'm back kind of with Social Security because they make a lot of these decisions. I went back to them on whether she could get her B or not. It went all the way to Senator Ernst's office so I could get this done, and it got done. Can't tell you how many prayers were given up, and we got her and got it backdated to the date she needed. So the 8-month thing, you got to keep in touch, my point is, with your agent on things that are happening in your life when you might not even realize. I didn't realize that. We still had health insurance. Everything was fine. I go, yeah, but you need to get your B ordered because you've got 8 months now. Once that active employment ended, see where it says active employment? That was the key. And once he no longer had active employment, that 8-month clock started. Okay. I think that's good here. Okay, so, and these are just some retirement considerations, and you probably thought about these as when you're retiring, okay, you want to look at your current health plan. I've looked at, I've done comparisons, and we do this, you guys. This is what we do. We'll help you. Just come in and go, hey, should I stay on my employer group plan, or should I go ahead and take Medicare? You guys can keep working and take your Medicare if you want. You have to look at what you're paying for your group health plan. So if you're the spouse and you're on your spouse, there's the employee and the spouse. You're the spouse on the employee's plan, and they don't cover much for you. So how much are you guys together paying? Get the price from those HR folks to find out what's mine, the employee's rate, because they usually contribute to the employee rate. Are they contributing to the spouse's rate? A lot of times they're not. And so you look at the spouse rate and what you can save, and then look at Medicare. So, you're turning 65. You don't have to stay on the group plan. You might peel off. If you're the employee, you might be getting enough in terms of their contribution from your employer that you want to stay. But those are all the things you want to take into effect. I had one guy go, okay, Lynn, let me calculate this right. I'm going to keep working because my spouse is younger than I am. So I'm going to go past 65. How many months do I need, Lynn? And I go, well, COBRA is 18 months, generally speaking. There's some caveats for 36 months, but let's use 18. Again, is your company 20 or more employees? Okay. And so he said, I'm going to keep working 18 months past my 65th birthday because my wife literally is 18 months younger than I am. So she's going to catch up, get to 65, then I'm retiring. So I'm going to retire though and be done, and she can take COBRA. Well, let's look at those rates. What are the COBRA rates? Because those rates, you guys, right now you're paying 100% of that because you're not getting the employer contribution anymore. So if he keeps working though, what I'm saying, if he keeps working instead of just retired, right? That's why people keep working, because we've seen the COBRA rates and going, holy cow. So we don't do COBRA. I'm going to work a little longer, get my wife or husband up to 65, right? Does that make sense? Yeah, so. Yeah, for creditable coverage. Yeah. So I think what I meant to say is if I'll say the employee is a he, and if he did retire at 65, and she would take COBRA until she got to 65, and not after that, because the creditable rules. Yeah, I kind of. Yeah. He wouldn't take COBRA. Yeah, she would, just to get her to 65. Yeah, I think I misspoke there. So there's so many scenarios you can play out here. So, but yeah, they definitely, as you can see, kind of intertwine. So, but things to think about. That's why I say, is the company more than 20 or not? But here's one thing is I had a guy say, okay, I'm going to go ahead and retire at 65. And he calculated 18 months for his spouse. And then he found out he was only, his company was less than 20 employees, because everybody says, oh yeah, I know what COBRA is. I get coverage. I'll get COBRA. It's guaranteed. Well, he really only got Iowa continuation of coverage because their company was less than 20 employees. Iowa continuation is only 9 months. So we got an exception made to get them the 18 months for his spouse to be able to, take the COBRA there under the age of 65 to get her all the way up to 65. So a lot of unique things can happen along the way, for sure. But we're here to help you hopefully figure out, when do I want to retire? When do I want to draw Social Security? When do I take Medicare? Not only for you, but for your spouse as well. Okay, so let's talk about the gaps in Medicare. When they built this thing in 1965, they built it not to cover everything. So here's your Part A. You go in the hospital. Let's assume you don't do anything else, but you have Medicare A and B. I'm going to pay my A is free. I'm going to pay my $174.70 for my Part B. I'm drawing my Social Security now. Life is good. I'm not doing anything else, Lynn. All right, go ahead. I mean, that's fine. The last number I saw is probably about 10% of the population. They only have Medicare A and B. They don't do anything else. I go, well, I would at least do a Medicare Advantage plan, but we'll talk about that in a minute. Like, it's zero premium. But okay, so you're on the hook for $1,600 each time you go into the hospital. And it's called a benefit period, you guys. So it's not just once a year. If I go in, then I'm back out. If I'm out for at least 60 days, I go back in again. I'm on the hook for another $1,632. And that number goes up every year, just like all our numbers go up every year, right? They're rated up with inflation. But Medicare pays the rest. So it doesn't matter if I got a $100,000 bill in the hospital. If all I have is Medicare A and B, I'm owing the first $1,632 during that benefit period. Okay. Now, again, I just want to say, see where it says approved amount? Medicare has to approve this stuff. So, and usually all the normal stuff, it's fine. I mean, all the surgeries and all of that is fine. It's when you start to get like, is acupuncture covered? Some of the holistic methods, which some of them are great, right? But not everything's Medicare approved. So your doctors know what's Medicare approved. Most everything the traditional stuff you're doing, right? It's all Medicare approved. If you're looking at some treatments that might be a little different, you got to check. But if Medicare approves it, right, then you're good to go. Then these things follow true. On the Part B, on these claims that are your doctor visits, your outpatient surgeries, et cetera, This has a deductible once a year, $240 deductible, okay? And then Medicare pays 80%, you're on the hook for 20%. That's the gaps of Medicare. And I don't like that. There's no safety net. There's no max limit. Like I could, if I didn't have anything besides A and B. So I call this kind of leaving you naked, leaving you exposed, right? I mean, so this is why we talk about what can we do to cover the gaps that Medicare A and B all by themselves don't cover. And that's where we get into our choices of Medicare Advantage or Medicare Supplement. Now, before I get there, I do want to make sure you understand that Medicare never did cover, didn't intend to cover, I should say, drugs, dental, vision, hearing benefits, gym memberships, preventive. I mean, some of this stuff, they do cover more and more, like they cover the preventive benefits now. We've put together we've got a standalone drug plan, but these are not built into, none of these are built into Medicare, itself. So just want to make sure you're aware of that. So then what do we do? And I really think, you guys, it's one of two choices. You either go with a Medicare supplement and a Part D drug plan, or you go with a Medicare Advantage plan. So it's really, now you've got choices inside of those two choices, okay, of who you go with, what insurance company and what type of plan you go with. But if you narrow it down, it is just one path or the other. And I like to say, I mean, I usually ask this, and some of you are shy. I will admit, I like to play cards. I have gone to Prairie Meadows, maybe just once or twice. No, sometimes we have meetings there, and then I have to go when we have a meeting there, right? But no, I mean, some of us like to play cards. I used to play with my mom when she was 75 years old. She's not with us now. I just lost her this past summer. But she taught me how to play Mississippi Stud. It's one of my favorite card games. Anyway, here's the deal, you guys. I'm a risk taker. That's just me. I would say Mom probably was too. Now, we had limits. We only took so much. And when it was gone, right? But what I'm saying is some of us are a little more risk takers than others, right? And so I think what you'll find is, those that are a little bit more willing to take a risk might look at that Medicare Advantage plan. Those that I want things just how I want them, and I want to be able to predict it, and I don't want any risk, would be more of a Medicare supplement. And with that, then you have to buy a standalone prescription drug plan with that, because in the Medicare Advantage plan, your health and drug plan is all built together, okay? So let's get into a little bit more of what that looks like. So just kind of, So as I said, you still have original Medicare. So there's kind of a picture of your Medicare card. You'll notice also a kind of a funky number. It used to be our Social Security number, seriously, right? There it is, right there for all the world to see. Like, put your Social Security number away, but can I see your Medicare card, please? Okay, there's your social. Okay, so this came out several years ago. So everybody now's got a unique Medicare beneficiary identification number, MBI, they call it. So that's what's critical, and that's what we need this card to do anything. So I'm going to use Kurt as another example. I was talking to Kurt, and both of us are actually aging into Medicare this next year in 2020. I hope you don't mind I just said that, Kurt. We're aging into Medicare. Well, that's why he's here, right? We're aging into Medicare next year. And so so we know that in getting our identification card, as we look to age in and make that decision, right? Do I want to either buy in or not? Getting this card, I can't do anything. I can't buy a supplement or an Advantage plan without this card. So that's why we say usually about 90 days ahead of time, as I was saying earlier, you can order your card. Then once your card comes in, now we can talk about which way do you want to go, option 1 or option 2. So option 1 here, we're just saying, is the one that's been around the longest. This is what I call the peace of mind, right? This is non-risk taker. This is, I want to pay a certain dollar amount, and I want to know that whatever happens is covered, and I don't have to worry about it. And there's a lot of people in that camp, let me tell you. And they've added the prescription drug plan in 2006 was the first year we could market these prescription drug plans. It actually was legislation that the younger Bush signed into law in 2003, and it took that long to get it into the market in 2006. So I've been working with prescription drug plans since 2006. And every year they change, because what the government, it's kind of a private-public partnership, they call it. The government said, hey, we're going to tell you what these plans ought to look like, and now we're going to let you bid. And so individual private insurance companies bid on offering these drug plans to you all, okay? And so they're different every year, because they can apply one year and decide not to do it the next year. Now, they'll be penalized if they pull out, because the government goes, we don't want people in and out. If you pull out, you can't get back in this market for so many years, okay? So usually it's pretty consistent. You have the same players that are in. You've got your Wellmarks, you've got your Aetnas, you've got your Humanas and your Cignas. And so, the United Healthcare, All of these are the common players that are playing in the prescription drug plan. So we get the Medicare card, then we could look at getting that supplement and then the prescription drug benefits, okay? But all those are last two buying decisions, right? I could buy a Blue Cross supplement and get a Humana drug plan. I could buy a Humana supplement and get a Blue Cross drug plan. I can mix and match, right? So what we do is try to help you figure out what's most important to you. And so we talk about Medicare supplement, if that's the way you want to go. We'll get to a next slide here in just a second. And then we'll talk about the prescription drugs, okay, and see which plan might be best for you there. So a couple decisions there to be made, but it's all good. You'll notice here that when the government came out with these supplements, and I think it was in I'm going to say the 80s maybe, they came out with Medicare supplements because they realized people needed help filling the gaps. So when they came out with these, they standardized them, you guys. And they call them, they're not calling them parts. Notice that they've got here the Part A deductible and Part B. This is Medicare. But then all of a sudden they created these standardized plans. Oh, that's catchy, right? Okay, so it's, and then they used letters of the alphabet, just like parts of Medicare. So no, the most common plan is F and G of all of these. N gets some traction, but Plan F and Plan G. And then we also have a high deductible G, which I kind of like. But those are the standardized plans. And each individual private insurance company, I'll use Wellmark, they're the biggest player in town. Wellmark says, we're going to offer F and high deductible F and G and M and whatever. They get to say which plans they want to offer, but guess what? Their plan is identical to Aetna's, is identical to Humana's. They're all the same because the government designed them, which is meant to make it easier for the consumer. And I think it does, right? So what's different about them then? Price, service, right? Commitment to our market. Are they in? Are they out? I mean, how often do they have rate increases? What do their rate increases look like? That's where we help you with that. I have a really cool software program that I get in and I quote, and it shows how much market share they have. You might go, oh, look at that one. That's the cheapest. And I go, yep. And they've got about 10 people in Iowa that have that policy, versus, oh, this one, it's not the cheapest, but they've got 500,000 people in Iowa that have that plan. Now, why does that matter, you guys? Because you guys, insurance, you guys know this, right? But insurance is all about the pool. It's all about the number of people that are sharing the risk inside that pool. So you gather so much in premium, you pay so much out in claims, and you hope there's a little something to run the company in the meantime, right? So when you have a bigger pool, generally you're spreading that risk over more people. We keep rates down. That's what we want, right? I want lower premiums. I don't want to be paying any more than I have to. All right, so we help you with that. And notice that if you are signing up for a Medicare supplement during your initial enrollment period or a special enrollment period, like when you're getting your B, no health questions, okay? This is what I was talking about earlier. But if you decide, I had somebody do this, they said, well, I bought this company, but now their prices keep going up every year. Yep, that's what happens. Can I look at another company? Yep, now we need to answer health questions. That's okay. I mean, let's go through the list. Here you go. Are you this? Are you that? Do you have this? Do you have that? And we'll see if you can pass. Then that company will take you, and then you can get a lower rate, right? So that's the caveat about supplements. And so a lot of times when people get in one, they tend to stay. So you kind of want to look at a company for the long haul. If I want to stay in this for the long term, but just know rates do go up because, by the way, they're age rated. So a 65-year-old is going to pay less than a 66, 67, et cetera, right? So when I get to 81, I think Blue Cross, I know, stops raising that. 81 and on up, you're paying the same rate, right? God bless you, you're still with us, right? Now, they still might have a rate increase on top of that, right? So that's where you can see, one year I saw they were negative. Like, what? They had a negative rate increase, okay? And usually, though, they're incrementally, usually we try to go, please keep it under double digits, keeping up, at least with cost of inflation. I can see a 2 or 3% increase, but okay. I want to point one thing out while we're here, because as I mentioned, F is most popular, but you can't get that anymore. If you age into Medicare after 1/1 of 2020, on or after 1/1 of 2020, you can't get F anymore. And F we always talked about is the Cadillac. Because, and I just talked to a lady today, 85 years old, you guys, I'm doing her drug review next week. And I go, Margie, how you doing? And she goes, well, I'm feeling better. And I go, uh-oh, feeling better from what? What were you sick? Thinking maybe she had a little sniffles. Oh, I had a heart attack, October 18th. Okay, then. Holy cow. Because she's 85, She has a Medicare supplement plan F. And we talked about last year taking her off the supplement. She talked about moving to a Medicare Advantage plan. We'll get to that in just a second. And she still has her F. Now, nobody else can get that, but here's the deal. She will pay nothing out of pocket. She's paying her premium every month, which could be $300, $400 a month, you guys. Seriously, $300 or $400 a month for a premium on top of her Part B, which is $170, $470, okay? So maybe like $500 a month she can be paying, but guess what? She will pay nothing for, as long as her procedures, everything done is Medicare approved, she pays nothing out of pocket. She doesn't worry about the bills. It doesn't matter if she took air ambulance flighted, ground ambulance, surgeries, drugs, anesthesia, none of that matters, okay? So even getting out, going to skilled care, nothing. As long as she has 3 midnights, and they're looking to waive that rule, but then you can go into skilled care, nothing, pay nothing. It's incredible. A lot of people love these. Now, G is the next best one. And the only thing that G is different than F is once a year, $240, I'm going to see if I can do a little light on here, the $240 Part B deductible. So if Margie had had Plan G, and she had all this stuff in the hospital, her Part B, remember, it's your doctor office visits. So now when she goes to see her doctor for her follow-up visit, she'd be on the hook for once a year, that $240 deductible, and then that's it. And that's why I say you got to compare what these prices are to what you're paying at work. Because I'll bet you most employer group plans do not have a $240 deductible, right? I mean, most employer group plans, you guys, are that $1,000, $2,000, $5,000. Ours is $4,000 at our company. I mean, it's a high deductible plan, but you got to look at that. And by the way, you guys, there's also something called an out-of-pocket max, meaning how much will I have to pay? And you have them on your group plans today if you're still on them. You guys, there is no out-of-pocket max, because once I pay $240, I pay nothing else after that. It doesn't matter what I rack up in charges, hundreds of thousands of dollars, it doesn't matter. But do you see how? Peace of mind. A supplement is peace of mind. I'm not going to worry about it. You're paying though. I get those people that go, but Lynn, I'm healthy. Why would I spend $150 a month? And I'll use that as a rough idea. Your supplement plus a drug plan, age 65. Why would I pay $150 a month? I'm healthy. And I'm not using those benefits. And I go, well, then we look at a Medicare Advantage plan. And I'll hold that because let me just finish out. I talked about Part D really briefly here, but monthly premium on the Part D, right? That goes along with that. Let's go back just real quick on the supplement right there. I'm going, here's our Part D right there. So our Part D plan right here. Okay, so we talked about supplement. We're going to Part D. And I got ahead of myself a little bit on the Med Advantage. But again, private insurance companies offer it, can change every year. This is why we do reviews every year. And our people get our letter. Anybody a client at KHI in here? You get our letters? Not yet? Yes? Okay. You get our letters and you say, come on, get your drugs filled out and sign the scope of appointment. The government requires us to have you sign to agree to meet with us. And then we do a review of the plans. And don't forget, IRMA can impact Part D as well. So that's why keeping your income below that 103 or 206, if you can, on your taxes, right, will help you from paying a little bit extra. I think I might even have a chart in here on that. See how on this one, you'll just pay the regular price, but now they don't increase because we don't know what Part D drug plan you're going to buy. You might get a plan. You guys, there's a plan coming out in 2025 that's zero premium. Zero premium. It's a longer story. They decided to cut the agents out, so they're not acknowledging us, okay? And so it's WellCare. I don't mind telling you, it's WellCare is the company, and they decided not to use agents anymore. And so, okay. Like, really? So you're going to charge zero for the premium of the plan. Anyway, so, but if you had that plan anyway, then you would just pay an additional $12.90 and you can see on up. So that would be an additional you'd get to pay on those. So sorry, I got off on that. It's frustrating because, yeah, anyway. All right, we're here to help. Speaking of Part D changes for 2025, and this is why things are a little bit crazy, I'd say, this fall, because in the Inflation Reduction Act of 2022, that legislation that got passed and is now law says no senior, nobody on Medicare will pay more than $2,000 in out-of-pocket costs for their drugs. So this is separate. This is your drugs, not your medical now. Okay, this is for drugs. So remember I said G or F? Okay, pays all that, but not the drug. The drug is separate. So any of your drug payments that are what I call maintenance drugs or those outpatient drugs, right, where you go pick them up at the pharmacy. I'm not talking about the drugs while you're in the hospital. That's all going under Part A. Okay, that's all there. But these are the ones you take outside of being in the hospital. So what they've got is an annual deductible. Some plans have it, some don't. It's $590. You have to pay the whole full price of all your drugs until you reach $590 for some plans. Then you get into the initial coverage area. Then you won't pay any more than 25% of the cost of the drug. And then once you've done that, you've reached your $2,000, you're done paying. You go into catastrophic coverage, it's like you don't pay anything more. The drug company, the insurance company and the federal government and come together to pay the balance. And then January 1 starts the new year and you start all over again. So that is good news for a lot of you guys. I knew people are spending $10,000, $12,000 a year on drugs. And some of you maybe at Compass have clients that you were helping to manage. And it's like, you got to account for that. And it's horrible. But the money's got to come from somewhere. So that's exactly right. That's a really great point. I'll repeat it again for those online, that it's only for drugs that the insurance company covers. So if they don't cover that drug, that's on you and it doesn't go toward the $2,000. It's absolutely true. And that's why we sit with our folks and look at which ones covers because that's all that we want to know anymore almost is if you're taking a lot of meds and expensive ones, I just want to find a plan that covers that drug. That's the plan you want to be on because you're probably going to hit your out-of-pocket max of $2,000, right? So kind of right, just see how quickly you can get there. So yes. By the way, using GoodRx and some of those other discount programs, sometimes you can get the actual manufacturer of the drug. They have programs sort of for some of those expensive drugs to get you help. But you're correct, it will not flow through the insurance on this plan if it's not covered, okay? Okay, so option 2 is the Medicare Advantage. And so this is where you still have to sign up for Medicare, but the reason we put the red X through there is you don't show that card to your provider, your doctor, your hospital. Claims are not going to Medicare. The claims are going to go to your independent insurance company, whether you chose Wellmark, United Healthcare, Aetna, Humana, Medigold. I guess Mercy One is now, they've changed the name. WellCare just came into the state with these Medicare Advantage plans. So we've got about 5 plans that are in the state of Iowa, and it's all by zip code, you guys. So I guess I get to that on the next slide. But these Medicare Advantage plans now, they really take all the benefits of A and B, that's in your Medicare card. They take these benefits of Part A and Part B, they build those into their health plan, so their benefits can't be any worse than what the government offers with A and B all by themselves, okay? So their benefits have to be as good or better than just Part A and B. And then it's kind of like the current plan you might be on with your employer group. There are deductibles, there's co-pays, there's out-of-pocket maximums. And here's the catch, there's no premium. I shouldn't say a catch, but there's no premium, right? What, right? So it's got drug plan built into it. So it's got your hospitalization, your A, your B, your doctor visits, and your drug plan all wrapped up into one plan with one ID card. And I want to get to the next slide because it has a little bit more of the details. Plans vary by the county you live in. So your sister-in-law or brother-in-law that lives in somewhere else will have different options perhaps than you do, because the companies that offer these, like the Wellmarks and et cetera, as I said, they don't have to be in every county. Now, Wellmark is in every county with their Medicare Advantage plan. And actually, I think everyone but one. There's Dubuque County is a struggle because Medical Associates is there. They're a doctor and their insurance. So they don't let Wellmark play in that county, in Dubuque County. But otherwise, I believe then they're in all the other counties. And again, IRMA could still apply because the premium is zero. The premium is zero. Some plans have a premium, but most of the plans we're marketing are zero premium. So I don't know about you, but if I heard somebody tell me that, I'm like, and I know there's no free lunch, like, what's the hook? What's the catch? Well, the catch is you pay as you go. So meaning, let me just get to the, I think I have it. Actually, I want to comment on this one right here. The plans set an out-of-pocket maximum. Those are required by Medicare, and you pay co-pays for services. So zero premium unless you have to pay your IRMA. You go see your doctor. I know the primary care doc, most of them are zero, they're free. Go see your primary care doc for anything you want. You don't pay a copay. You don't pay anything. Go to see a specialist. Most of them are 30 or 40 bucks copay, right? Go into the hospital. Most of them are around $350 to $400 a day for the first 6 days. And if you are in longer than that, there's no more payment. You only pay the max would be 6 days. If you're only in 2 days, you pay 2 days. But if you're in 20 days, you pay 6 days. If you're in 100 days, you pay 6 days, okay? So right there, but all that money goes toward the out-of-pocket maximum that Medicare requires. So that's the safety net. So that's the risk though, right? Remember what I said? When you go to the casino, I'm going to confess, 300, it could be my limit. Did I say that? I don't, but 300 is like my out-of-pocket max. You know what I'm saying? Like that's my safety net, then go home and don't go to the ATM machine, right? And I see how long I can sit there for that. Okay. Well, anyway, that they have their out-of-pocket maximums, right, on these plans. So I call it then you kind of pay as you go. So you see how the supplement on one hand is peace of mind, but I'm going to pay $150 a month. Just use that as a rough number. I'm going to pay $150 a month whether I use my benefits or not. On this plan, I'm going to pay nothing, and I'll only pay if I need benefits. And some people love that, and some people go, and I don't care. I want you to choose what's right for you. And I have some spouses that go, he takes one and she takes the other, and vice versa, right? Because of their health situation, because of the way they want to manage the plan, the benefits involved with the plan. I'm going to keep going here, and we'll get to Q&A. I know okay. So again, must offer the A and B benefits. I already mentioned that, and may include prescription drug. They change every year again, and there's a network of providers. This is the big difference between using original Medicare with a supplement and using a Medicare Advantage plan are the doctors in the network. Just like a plan on your employer group, you have to check and see, is my doctor in the network? That's the same thing on these Medicare Advantage plans, but really not so on the Medicare supplements. Why? Because if a doctor takes Medicare and who doesn't, we're a big market, you guys. They make money on us, right? The government pays them to take care of us. Then most doctors take Medicare. So that's your question if you want to see somebody when you're on a supplement. When you're on an Advantage plan, you have to, we have directories and we can look up, are my doctors in? And that's part of our due diligence with you. Are your drugs covered and are your doctors covered? That's what I don't worry about that on a supplement because all the doctors take Medicare, really. I mean, I should say most, right? And again, here's a key. No underwriting. These plans are all guaranteed issue. So here's what happens. Many clients, they buy these, and then every year we look and see, what are the plans? How have they changed? Should I move to another one? We can move. There's no underwriting on Medicare Advantage. But is there underwriting on Medicare supplements? Yes. And that's a big difference between if I stay with the supplement and I want to move to something else, I'm going to have to try to answer the health questions to see if I can move to a supplement. If I want to go from a supplement to Advantage, no health questions. It's a guaranteed issue. And then every year you can renew and change these plans, okay? The other thing is these plans do offer additional benefits. Why? The government says you can. They don't have them standardized on their supplement plans, but on Advantage plans, they're like, knock yourself out. And so they're like, hey, if we keep that client healthy, we make money. So how do they make money? They make money on these Medicare Advantage plans when you stay healthy. Why? Because you stay out of the hospital. And that's how they can make money. The government pays them, you guys, to have you. Because remember that Part A, $500, your Part B, let's just round it to 200. There's $700 a month. They're getting a little bit more than that. But the government pays these insurance companies to take care of you. That's how they can charge zero premium. They're not charging you. They're getting paid by the government to take care of you. And if they can keep you healthy, they can keep these premiums at zero. And then they can throw in, hey, I'm going to offer some hearing benefits. Guess what? You're more engaged and you'll live better life if you can hear. Dental, huge thing about dental. Vision, same thing. Gym memberships, right? So all of these things are wrapped into these Advantage plans. And that's what entice people. Like, again, I don't care. My mom was on one of these, but you know what my mom goes? I'm not going to the gym, but I'll go to the dentist. And that's all built in, you guys, at zero premium. And you get 2 free cleanings, et cetera. Okay, I'm getting the hook here. And look at that. We're at the questions. Holy cow, that was great timing. Come on over, Justin.
Actually, Lynn, I have a couple questions for you around Medicare Advantage.
Okay.
One is, and correct me if I'm wrong, but did I see in the news that some companies are no longer offering that service or getting out of that? And is that something that you're considering and people should be considering, or what's going on there?
Yeah, so as I mentioned, thanks for the question. As I mentioned, these companies are private insurance companies and they have to apply every year to the government, usually in about June, to offer benefits for the following year, January 1 the following year. And so we had a case this year. Health Partners Unity Point Health was a very popular Medicare Advantage plan. And it was a company owned by Unity Point Health and a company out of Bloomington, Minnesota called Health Partners. They came together, formed a company, and were offering an amazing plan. We loved their plan. And they made a decision to pull out. I think part of it, now this is me opinionating, I think part of it was the changes to the drug plan. When I told you the drugs were going to be capped at $2,000, I think that was a concern of theirs. I think I think they were talking about lowering the reimbursement to the insurance company. So they're all trying to figure out how they're going to at least break even. Now, the companies that are traded on Wall Street need to return a return to their shareholders, right? So Wellmark is not that. So there's a couple companies. Mercy One is obviously nonprofit. Wellmark is a mutual company, so they're not traded on Wall Street. But some of these companies need to return, to their shareholders.
So that's
right?
a good consideration as if people are going down that road of Medicare Advantage.
Well, and the good news is everybody can make a new choice every year. So these people that have that plan, now they have to make a move. They can't stay with what they have because what they have has gone away.
And one other thing I saw with Medicare Advantage, I believe it's coming up this year, is if you're on one of those plans, these insurance companies are mandated to send you a letter halfway through the year to remind you and tell you, here's some benefits you have left that you haven't taken. Because as Lynn was sharing, they have extra benefits on these plans. So here's your little reminder that you have these benefits for this year that you're still eligible for if you want to use them. I think that's something I read.
Yeah, no, for sure. Most of these Medicare Advantage plans offer something called an over-the-counter benefit. And so they'll send you, or they don't send you, but they tell you, you can get online or use your ID card. Like United Healthcare partners with Walmart. You can literally take your ID card, go to Walmart, and they'll give you up to like $50 a quarter. All the companies are a little different. It could be 50, 60, 40, a quarter per person. And you can spend it on things like vitamins. They know a list of stuff. You can't buy alcohol, of course, or anything else, but you can certainly buy vitamins and anything kind of health related, right? And yeah, so it is good. They will send a reminder going, hey, don't forget to use these benefits. Some of them are incenting you to get up and walk. And if you walk so much, it'll send you money for that. If you go get your preventive exams, they will have money for you for that. So they're trying to keep, you see the theme there, right, is keep you healthy. So yeah, that's definitely true.
I just one thing to add from earlier when Lynn talked about people who are on disability, who then, if they're on disability for a couple years, are able to qualify to be on Medicare. And so even if they go off disability, they are still eligible to remain on Medicare for 7 years after that, subject to a couple of rules in terms of accessibility and things like that to other health coverage. So that's something to remember if you know people who are on disability who are not nearing retirement age, because there's a good many people as well who end up at least temporarily on disability, and it's good to know that they have that available to them.
Okay, so as usual, this is a topic with a lot of great information, and I want to be respectful of everyone's time. We are right around 1 o'clock here. Feel free to stay if you want to do a little Q&A for maybe the next 5 minutes or so with Lynn.
Sure.
But anything beyond that will probably just keep the day moving. One big takeaway, though, right? When you're talking about Medicare, or if you're talking with your Compass advisor about retirement, there's a lot of similarities in that we want to have great communication. So as things are happening in your financial life, you want to let us know so we can navigate and help you strategize your best choice to make. And the same thing applies when you're preparing for retirement, coming into these transitions, whether it's retirement or turning 65, and there's health insurance questions. And it's not just for you, it's for a spouse or maybe some dependents, right? So they're a great resource, Lynn and her team, in that area. And it's a changing landscape every year as well. So great communication, right? If things happen, communicate with Lynn or whoever you're using for your help, just like you'd communicate with us. Does anyone have a general question that they'd like to ask?
On the prescription on the actual drugs, I know they're tier 1, 2, 3, 4, and there's prices based on each one of those. And I know the tiers can change 1 year to the next. Where do you go to see what drugs you're taking are in which tier? Is that by company or is that a general?
Great question. I'll repeat it for the folks online, that just asking about where do you go to find the drugs, what tier they are, what price it is. You guys, we are such big users of Medicare.gov. So remember I talked about SSA.gov and having your account set up? For all of the people that do business with KHI, we ask your permission to help with you set up your Medicare.gov account. We have a login and a password. We save it in our secure system. You have it if you want to go in and use it as well. That's the tool we use to go in and look at drugs. What tier did they change to? Then I can even see you guys by pharmacy. It even matters. Is it mail order? Is it with Hy-Vee? Is it Medicap? Is it Walgreens, CVS, Costco? We've got all of those in that tool. Is amazing. So if you haven't been out to Medicare.gov, we can certainly help you, but we encourage you guys set up that account and you can evaluate, and it's awesome because they show what you're enrolled in or going to be enrolled in, what are your drugs, oh, what recent drugs, let's add that to my drug list so I can compare. Yep, you bet. Great question.
So someone who's turning 65 soon and this year, people have told us the Medicare Advantage plan is not a good one if you travel a lot. That seems to be a big issue, as the Compass people have helped us hopefully be able to travel in retirement. Can you address that if that's changed at all?
So most of the Medicare Advantage companies offer a PPO option. So if you recall in your days of employer group plans, an HMO is Iowa-based only, or a set market. So in Iowa, Iowa HMO is Iowa doctors only. A PPO is a national network. So you have those on your employer group plans. Well, they brought those to the Medicare Advantage plans. Not all companies offer a PPO. Many of them do. And I will just tell you, most of the ones that I recommend for my clients are PPO, just for that case. So what does that mean? And I'm going to use Wellmark again as an example, just because people know of them. And they have a nice national footprint, but so does UHC and so does Aetna. So these are, when you think about national companies and a national footprint, for every Medicare Advantage company in the other states that Blue Cross has, you have access to that network in that state. So let's say you want to go to Florida. Let me tell you, there's a huge Medicare or Medicare Advantage Florida Blue Cross plan. So you'd have access to all their providers, same with Texas, et cetera. The southern states are big on Medicare Advantage plans. So I just don't worry about it. But if you know you go to a certain place, it doesn't, we can look it up for you. We can go, let's get the zip code of where you want to go. Let's get a list of any of the providers in the area. So you would have coverage, and always you have coverage no matter where you are in the United States for emergency coverage, whether they're in or out of network. So if I'm having a heart attack and the ambulance races me to somebody that's not in network on my MA plan, they have to cover it as, the insurance company has to cover it as in network. Okay. Did that, I'm sorry? Internationally, you know what? There's some limited Medicare benefits up to like $50,000 on some Advantage plans and on the supplements. But most of that I look at like, and there's a deductible of $2. It's not very good, I'll just say. I always encourage people, get a additional travel health policy, not a travel policy on your traveling plans, not canceling flights and rearrange. No, a health insurance policy while you're traveling. And we do use Geo Blue, and they are a national footprint as well. So we encourage travel insurance, and we help folks with that all the time. Yeah.
Okay, one more question here.
When you said the hospital stay is a maximum out of pocket per stay through Part A of 1632, is that accurate?
That's a if you're on Medicare A only with no supplement or Advantage plan, that's their deductible, if you will, for that benefit period. But if you have a supplement or an Advantage plan, that kind of takes over. So whatever Medicare doesn't pay, the supplement pays. So if you had a plan G, for example, that takes care of that 1632. On the Advantage plan, the way they do it is they charge that copay for each day you're in the hospital up to 6 days. Let's say you're in all 6 days, just for easy math, 6, and let's round it to 400, right? Would be 6 times 400 should be $2,400. That would be my responsibility. And that $2,400 goes towards my out-of-pocket max. Yes, yep. Most of the maxes, by the way, you guys are running right now around 30. Blue Cross's is $3,750. I think Aetna UHC are right around $3,900. So we're seeing this just under $4,000 is the max out of pocket for most of the MA plans competing in Iowa right now. And trust me, they are competing. It is a dogfight. They want your business because they're getting paid by the government to take care of you. So I'm just saying it's a very competitive world. And yes, so these numbers, they will change slightly every year, but we're still at zero premium, which is very good for us in Iowa. And other states, it's different. They pay a premium for these MA plans. So it's interesting. Yeah.
If you have parts A, B, and D, and you get a supplement, does the supplement also carry over to the drug costs?
No.
It does not. Okay.
So the supplement, just so we're clear, so any claims that go to part A or B, and then your supplement picks up whatever A or B doesn't, and then your drug plan is completely separate. You have a premium and then usually co-pays along the way, and then now you have an out-of-pocket max on your drug plan of $2,000. You never had before, starting next year. Yep.
Okay, well, thank you very much, Lynn. Excellent information as always. There's a lot there. If anyone has further questions, yeah.
Thanks.
Thank you. If anyone has further questions, there's Lynn's information. We have her contact information as well. So thanks, everybody. Great turnout today. Thank you for being Compass clients and being a part of our Compass family. We really, really appreciate that. And we look forward to seeing you guys next time. We do not have a monthly event coming up in December. Around the holidays, our next event will be in January, second week of January, that Thursday. And we'll be talking about technology and some of the new technology that's going on in the world and how is that impacting markets and how is that impacting investments. So be on the lookout for that in January. Thank you, everybody.